Thanks very much, Kari. Well, welcome everybody to CPHE webinar series. It's good to be with you all this afternoon. As Kari said, my name is Harry and I'll be sharing first with us this afternoon. And as you can see by the title slide, hopefully that you can see that okay. I'll be talking a little bit about navigating the experiences and challenges of caring for someone with cerebral palsy this afternoon. So hopefully that's interesting for you. I'll keep it short, but hopefully we'll see how we go. I'd just like to start with a bit of a welcome to country. So I'd like to acknowledge the traditional custodians on the land on which we meet virtually today, pay our respects to elders past and present. I just want to extend respect to Aboriginal or Torres Strait Islander colleagues and guests that are with us today. So just so you know a little bit about myself, I thought I'd give a bit of a brief introduction so you know where I'm coming from. So as I said, I'm Harry. I'm a medical student out at Monash University, and I've completed 4 of the 5 years of the undergraduate course out there, and then decided this year to have a bit of some time off full-time study. So I'm currently in a bit of a gap year, enjoying what freedoms I can in our current lockdown state. I became involved with CP Achieve earlier this year when, through a bit of networking, I got introduced to Dr Robbie Eres, who a few of you might know. He's a postdoctoral research fellow with CP Achieve and MCRI. I think he's actually due to speak next month on this series, so stay tuned for that one. So I've been helping him a little this year in one of the projects that he's got up and going, looking at the social, mental and physical health of carers of young people with cerebral palsy, which also happens to be what I do. So in my time outside of university, I'm also a disability support worker, and I've been caring for a client affected by cerebral palsy since 2018, and I've worked with her in various capacities in the years since. So I thought today, when Kari asked me to speak, it would be hopefully interesting for some people to share my experience and some of the challenges and considerations that I've found in caring for a young person with cerebral palsy. So I guess I'm sharing today in the hope that you might get my perspective, which might be a bit of a different perspective on some of the aspects of being a carer, the challenges, the rewards, and hopefully it helps you, whether you yourself are a carer or someone with CP, or just an interested listener, to gain a little more understanding of maybe the carer client relationship. Hopefully it's interesting for you. So as I said, I first started doing this kind of work in 2018, but before then I had never done anything like it before. I never really had any experience caring for someone with a disability before, so I really wasn't sure what to expect. Therefore, it was a pretty steep learning curve when I first started, trying to get familiar with the role on the go a bit and kind of work out what was required of me. There is a lot that goes into being a carer in terms of actual responsibilities, but one of the biggest considerations when I was reflecting on this that I found, especially early on, was being able to establish trust between myself and my client. There is a lot of trust that someone has to place in you when you're caring for them, especially someone that you've never met before. So being able to I found it trying to be approachable and friendly while also fulfilling your role and the responsibilities of that is important to show that you are trustworthy. You are in a privileged position as a carer. So being able to, keep that trust is important so you can have a good functional relationship. I guess whether that's trusting you to push them in a wheelchair up a mountain, or seeing them in their more vulnerable moments, being able to maintain confidentiality and respect their dignity goes a long way towards maintaining that trust. Another consideration that I thought of when I was thinking about this presentation was the adaptability that sometimes is required in this kind of role. One of the great things about my experience in this role is that it's so varied. I found myself doing all sorts of things. Some of the pictures that I got here are different places around Australia that I've been lucky enough to be in my role. So yeah, and I've got listed here a few of the different things that I've found myself doing over the past few years. So some of those include family trips and extended stays away in all sorts of places around Australia, which I'll speak to a little more next. But I've also found myself helping out around home, assisting with cooking and cleaning and just being around family a lot. It's also, my role has also been extended to include a more therapy assistant type role, being able to help work towards some of the goals that OTs and physios have put in place for my client. And last year, especially in the lockdown, we had to come up with some creative ways of how we could still pursue those goals over Zoom. So coming up with new ways to facilitate that was a bit of a challenge, and again required a certain amount of adaptability. I was actually able to go into school with my client as well as a teacher's aide, and that was pretty new for me for a couple of weeks. But it was, yeah, again, it was able to happen because of the trust that I built and the relationship that I built with my client. And I was able to stand in for a few weeks, which was quite a cool experience, really. And public outings and social interactions is another part of the role. And I found that being adaptable to try and help overcome some of the difficult social situations and managing things like public transport or paying for things, dealing with strangers, all that kind of thing, which can be quite daunting. So I guess the takeaway from that a little bit is to be willing to try new things and to be flexible, but also knowing what you're comfortable with and what you're willing to do and being able to communicate clearly about that, I guess. So some of the challenges that I have found in my own experience is on some of these extended stays or trips away with family that I've mentioned. So that is a part of my role that I've done quite a few times. You can see here on the left, there's a picture of us going to camping in Wilson's Prom, or right, we're going hiking in different places around Victoria for different trips. And obviously, it can be quite difficult to be out of your natural habitat or away from your home for long periods of time, let alone when you're working, I guess. So it can make finding the line between work and downtime quite difficult. So I guess when you're caring for someone around the clock or when you're around someone a lot of the time, finding time to be available and doing your role, as well as balancing that with time to maybe have a little bit of time for yourself and check in with yourself about how you're going, can be tricky. Because I think you do have to be aware of yourself. You have to be aware of how you're tracking along as someone who's caring for somebody else, because that's often a lot easier when you're doing okay yourself. So yeah, I think clear communication is important. I think whether you're a carer or whether you're someone who's being cared for or a family member, being able to clearly communicate about when you're around, or maybe when you can have a bit of time off to recharge, is really important. I think physical fitness is another thing that can be a challenge. It can be pretty genuinely hard work. A big part of my role is helping with mobility and pushing wheelchairs and things like that, which you can see in some of the photos. We've been able to make use of a hippocamp, which you might be familiar with. It's kind of an all-terrain wheelchair, which has been really great, actually. We've been able to go to some pretty amazing places, but I've kind of found myself pushing one through most conditions that you can think of, including, beaches, sand dunes, torrential rainstorms, snowstorms, mountains, forests, rivers. You can kind of name it, and we've probably been there, which has been really cool. But I guess it does require a certain amount of physicality, but I love that. And I've been lucky enough to work with a good friend of mine over the years who works with the same client, and we've been able to help each other out a lot with those more physically demanding tasks. But I guess it does require us knowing our limits and knowing how to work within those. One other thing that I thought of was navigating relationships with family. So I've touched on it a few times already. going away for extended periods of time or being around family members a lot, naturally you do spend a lot of time together. And at least in my role, your experience might be different of that. But I found that having a good relationship with family members makes things a lot easier for everybody. So putting time into being able to get to know each other and being personable and approachable and friendly has gone a long way to on both ends to making that kind of relationship easier. I guess there is also a challenge though to balance professionalism with being personable. At the end of the day, you are there to help and you're in a role and you're there to provide assistance. So being able to balance that can be a bit tricky, but I've had a very positive experience on that front. You can see the photo here, different trips that we've been on and different family members. I've blocked out the faces of a couple just to protect confidentiality, but it's a part of the role that I've found to be really positive. So yeah, it can be a challenge, but it can be a real positive as well. One last challenge that I'll just touch on briefly is kind of lies in knowing how much to help. So I think this might be different for everybody, but this is kind of just sharing from my own experience. But I found it sometimes hard to know when to assist and when to give kind of more freedom to my client to attempt things for herself. And finding that balance can be quite tricky because I guess I want to be available to assist, to be able to help and fulfill my role, but also to have respect for the dignity of my client and their desire to try things for themselves. This can be hard because it can change from day to day. Some days my client might really enjoy the challenge of trying new things and be up for a lot of things, and then other days it's a trickier day and it might be the opposite situation. So being able to really know your client well and develop that relationship and that trust that I'm not going to ask her to do something she's not comfortable with, but being able to know her capabilities so she can push herself a little bit and try things that help her to be more independent, which I think is a really positive thing. And I think I found it's been really positive being able to encourage engagement with some activities and attempting to try things even when that desire is not overly strong, because yeah, it does help with the developing of that independence and helping her to kind of overcome things and realize that she can do things more than she might have previously thought. I have had to realize that my experience has given me a certain lens in this. It's given me a certain perspective that I obviously haven't lived with a disability myself, so I have to understand that my own perspective is different. So particularly in public interactions, I've noticed this. Something that might appear fine to me or easy or comfortable might well not appear that way to my clients. So I guess knowing her well, knowing to understand and being able to understand how she might perceive the situation and being able to accommodate that and be respectful of that. So finally, just like to finish on the fact that this being able to help care for someone and be in that role is actually incredibly rewarding, despite the challenges that I've touched on. I think, and aside from the fact that I've been able to just see some pretty cool places in Australia, the real reward lies in the relationships that I've been able to develop over the years with my client and her kind of extended family, and being able to see the progression in those goals we've been working towards and the confidence that she's grown in and the independence that she's gained in some areas has been pretty amazing. So that's kind of all from me. So I hope you found that interesting. At least that's kind of my experience of what I've found. I'll be hanging around. There's some question time at the end after Magnus has shared. So if you've got any questions for me, then I'm happy to answer those. But yeah, I hope you found that interesting, and I'll hand over to Magnus now.